take you through my poster on plant cannabinoid signaling. So cannabis is used to treat a variety of issues from pain to anxiety to nausea, and these therapeutic effects are often attributed to THC and CBD, but there have been over 120 different plant cannabinoids isolated from cannabis, and not much is known about them. So the aim of my project is to assess the pharmacology of these 8 abundant plant cannabinoids. I have THC-like compounds, CBD-like compounds, and then CBG and CBC. And the big question is, how can cannabis do all of these different things? And can we design therapeutics that are more specific? And one possible way to do this is to exploit the concept of bias. So these phytocannabinoids interact with the cannabinoid type 1 and type 2 receptor, and these are both G protein coupled receptors, meaning they bind to a G protein and then elicit a specific physiological response. However, they actually bind to several different G protein families as well as beta arrestins, meaning they have a lot of different effects. And if we could exploit the concept of bias, where a drug stabilizes one shape of the receptor to only bind to one G protein and then have one physiological effect, then we could have drugs with fewer side effects. And so what I'm really looking at is how CB1 and CB2 couple to these G proteins in the presence of these phytocannabinoids in an effort to understand cannabis pharmacology in general. And then if we find a bias, we could use this as a structural lead to design therapeutics that have no intoxicating effects. And to do this, I am using dose response curves with a method called bioluminescence resonance energy transfer, which looks at the protein-protein interactions in live cells, and in this way I can see which G proteins these receptors are interacting with. So my results are a bit difficult to see, but I've looked at CB1 and CB2 with 2 isoforms, the GI1 and GI2, within the GIO inhibitory family. And just to highlight one interesting result, so I want to show you THCV compared to THC. These compounds are almost identical, except THCV has a shortened tail with 3 carbons instead of the 5 that THC has. And in this first column, you'll see THCV in blue and THC in pink. And it's quite difficult to see, but you'll see this kind of inverse agonism or antagonism at CB1, whereas in CB2, you're seeing a similar effect to the THC behavior, which is partial agonism. So that just highlights the importance of the tail in the pharmacology of these compounds, which is quite interesting, I think. So I will be continuing to characterize the other G proteins as well as beta arrestin, and then if a bias is found, that would be used to develop better therapeutics. Thank you so much for listening.